IPS West
No,
Bengal
no,
State
no,
Branch.
ma'am.
So,
Okay, sir.
so it will be started by me, and I will give you the opportunity to speak. Definitely,
Okay,
it will
sir.
be
Not a
definitely
problem.
given. Yeah. So, uh, okay. So, good evening, everybody. Today we are back again, IPS West Bengal State Branch. Wishing you all a very happy, Wednesday. So it is mid of the week, and we are having a webinar. So it may not be convenient for all to attend this webinar, but wherever you are, you can join from your laptop or mobile, or you can watch it on YouTube. So we are having today a discussion on brain biotics in anxiety and depression. Mainly, it is we will be discussing on microbiota and gut-brain axis. As we all know, since time memorial, healthy diet has been a part of healthy lifestyle. But it is only at the beginning of 21st century when the scientific link between these two were realized, and there has been a tremendous increase in research and published literature in last decade or so. So gut-brain axis is a two-way biochemical signaling pathway that takes place between GI tract and CNS. So what are involved in gut-brain axis? The CNS, neuroendocrine system, neuroimmune system, HP axis, and the peripheral parasympathetic arm of autonomic nervous system, particularly the enteric nervous system, vagus nerve, and gut microbiota. So this forms the gut-brain axis, which also called the microbiota gut-brain axis. So we have Dr. Ranjan Bhattacharya, who needs no introduction. He is an esteemed EC member of Indian Psychiatric Society and has been the ex-honorary secretary of IPS West Bengal State Branch. He will be speaking on this topic. We have Dr. Sajjan Singh, our president of IPS West Bengal State Branch. We will be welcoming all the delegates, and Dr. Sanjay Garg will be introducing the topic. We have Professor O.P. Singh amongst us, who will be chairing today's session. We are very pleased that Septalis Life Sciences have extended their cooperation in organizing this webinar. I would, before going to Dr. Sajjan Singh, I would like to give opportunity to Septalis Life Sciences to say a few words, and would like to allow them to use this platform to even promote their product, because they are providing the logistics for this today's program. Thank you.
Thank you, sir. Thank you so much for this opportunity, and good evening, everyone. And I'm Snehal, and on the behalf of Septalist, I welcome you all here. And I would like to extend my thanks to IPS West Bengal Society and especially Dr. Ranjan Bhattacharya for this opportunity, because this event and this platform is very, very important for us, since we wanted to talk more and more about the research part of it. And before we get started with the webinar, I would like to talk about Septalis. So Septalis is a Mumbai-based multi-specialty company, and we are majorly focusing on neurology, nephrology, and critical care. And we as a company believe in the philosophy of preventing the preventable. And today we are ranked amongst the top 3 companies in Indian nephrology segment and the fastest growing company in the neurology segment in India. And we all are here gathered to celebrate the Brain Awareness Week. And I believe most of us are aware what it is. So Brain Awareness Week, it is a basically global campaign. It was started to educate people more and more on the brain research and to bring more light on the hope for treatment, prevention, and possible cures for brain diseases. And we at Septalist aim to engage people more and more on brain research and become a medium to disseminate this knowledge. And we all are like, I believe that we all have heard since our childhood that there is a connection between the gut and every organ of your body, and especially with your brain. That's the reason we have requested our esteemed panel to discuss more about gut-brain axis. And we all are very delighted that you could have joined and empaneled this discussion. And we sincerely hope for many takeaways. Like there will be many takeaways for each and every one of us for today. So thank you, sir, and thank you, Kaustubh, sir, for giving this opportunity to us.
Thank you, Snehal. As she has introduced Septalis Life Sciences and the product which is related to today's topic, I will move on to Dr. Sajjan Singh, our president, very esteemed president, very senior psychiatrist from West Bengal. Sir, please say a few words to the delegates or the persons who are attending this webinar.
Thank you. Thank you.
Sir, please.
Ladies and gentlemen, all who are attending this program, and particularly the Professor O.P. Singh, who will be chairing the program, and Dr. Sanjay will be doing the introductory part, and Dr. Kaustubh Chakravarti, whose initiative, and Dr. Ranjan Bhattacharya will be speaking on the topic who will be speaking on probiotics in anxiety and depression. Now, this Brain Awareness Week, this is a campaign organized all over the world in different countries with the aim to understand the intricacy of brain function, brain role of the brain in the body in different diseases, and by understanding this, how to prevent diseases and how to treat diseases. To enhance this knowledge, this awareness program is being organized all over the world. And in relation to that, our Psychiatric Society West Bengal branch has organized, and Ranjan Bhattacharya would be giving the details about the role of probiotics in anxiety and depression. I hope this is a paper which will be dealing with cytokine hypothesis. Cytokine hypothesis for last few years have become very important part. The pro-inflammatory granules, and one of them is dysbiosis. While the dysbiosis, the cytokines, pro-inflammatory granules, break the barrier, gut barrier, enter into the brain.
Sajjan sir, I'm so sorry to interrupt you, but your voice is coming in pieces, sir.
Hello?
Sir, your voice is coming in pieces.
It's cracking. Are you connected to Wi-Fi, sir?
I think that is a technical problem because of the internet.
Yes.
Yes,
He
sir.
can't help. He can't
Not audible?
Sir,
Yeah,
you are audible,
You are
but
audible.
your voice is coming in
Sir.
pieces. We can see you.
Sir, please
but then-
continue, sir. No issues, sir. Please continue and
Sir, please continue.
Okay. Thank you. And affecting the brain, it causes many problems, among them anxiety, depression, the most common among psychiatric problems, which collectively affects 25% of the population of the world. And still, we do not have treatment very effective. Only 50% patients respond appropriately. Rest of the patients still do not respond. And so a lot of work, of research is required. This hyphen book some 8-10 years back, beyond neuroamines, And it was in one article, it was mentioned if a patient develops post-febrile depression, you add aspirin and patient response is better because that also works as anti-inflammatory. This research on these papers, on these topics, they have now described brain-gut axis and psychobiotics, all those new terms. And if you go through irritable bowel syndrome, they also describe big brain, small brain. The big brain in the head and small brain is the gut, and they have interactions. So this is very important. If the gut is not healthy or the brain is not healthy, vice versa, one may suffer from this problem. And if given probiotic supplements, their response is better. And if the diet includes this, still it will prevent. So detail would be dealt by the esteemed speaker, Dr. Ranjan Bhattacharya. Thank you very much. Thank you.
Thank you, sir. Next, I will go to our beloved Dada, Dr. Sanjay Garg, who is also the honorary treasurer of IPS West Bengal State Branch. I request Dr. Garg to introduce today's topic. Although we have said in bits and pieces, I expect a more kind of expert opinion from Dr. Sanjay Garg. Thank you, Dada.
Thanks a lot, Kaustav, for giving me the opportunity to talk here today. And my grateful thanks to everybody who's present, especially Dr. Sajjan Singh, our president, and Dr. Om Prakash Singh, our beloved Dada, and Dr. Ranjan Bhattacharya, my young brother. So it's a pleasure to speak at any program organized by the Indian Psychiatric Society, West Bengal State Branch. And today, I think is a very good topic that we are talking about. When I started my psychiatric practice in Kolkata, I would often hear from people that gas mathay uthi jache. This was a very, very common thing that I would hear. And people would often laugh about that, saying that how is that possible? But probably if we reflect and think today and what we are talking about, maybe they were correct. Maybe that's all where it starts from, like the gut. We have never sort of understood the gut in a proper manner. I think we often say that we have not understood the brain, but I think we know less and less about the gut. And in fact, if we reflect and think that probably gut is one of the most important organs that we need to focus upon and understand actually what is happening. And one of the most important things there are the gut microbes, which play an important role right from our birth to our death. We often hear that breast milk is supposed to be the best nutrition. It includes and starts the whole gut microbiome process. That's where the gut microbiome process starts. And then over the years, due to various foods we take, our exposure to other things, that gut microbiome atmosphere changes and determines as to what happens to us. We do know that there is a significant role of gut microbes. We often add them to antibiotics that we have been doing that since we started practice, since we started studying medicine, that this was a common thing, that when you gave antibiotics, the gut microbiome would alter, you would have issues, and then of course you would add those, and most of the antibiotics now have a combination of adding these gut probiotics to the combination that we use. So we did not realize that how important the role the probiotics had in mental health, and that was an area which was often ignored. Fortunately, this has come to the forefront. We do now understand that there is a significant relationship between the whole milieu of an individual, whether what we would think in terms of the serotonin and the other sort of endocrine systems, whether it be the pituitary hypothalamic axis, the gut microbiome axis, all of these have sort of intertwined, have a role combined with each other. They are not independent of each other. There is a combination, and I'm sure Dr. Ranjan Bhattacharya would elaborate upon that. So before I end, I would like to emphasize that yes, we do know a bit about all these probiotics and stuff, but I'm sure in future there will be a significant sort of treatment modality in any sort of mental health issues. Probably our lack of understanding, our lack of knowledge is not allowing us to use them in an appropriate and a significant manner. Unfortunately, most of the treatment that we have currently in our armory, whether it be antidepressants, antipsychotics, or any other molecules that we use, we do know that they have their own limitations, they have their own side effects. We are not very happy with the current medications that we have. And probably probiotics would be one area which could fulfill this gap, which could sort of help our clients to achieve a better quality of life, the recovery model that we follow. So hopefully this is a new path that we can tread upon. I would like to hear Dr. Ranjan Bhattacharya elaborate upon that so we can increase our knowledge about this and use this therapy in a more appropriate manner. Thank you very much.
Thank you, Dada, for your words of wisdom. Now I would like to invite Professor Om Prakash Singh sir for chair the session. Sir needs no introduction. Sir is the honorary editor of Indian Journal of Psychiatry and has served as a teacher, academician, and researcher since a long time. I would like to invite Sir, Dr. Ranjan Bhattacharya will be the speaker. I would like to invite Sir to introduce Dr. Ranjan Bhattacharya as well and say a few words regarding today's topic. Thank you, sir.
Thank you, Kaustubh. I think that Dr. Ranjan Bhattacharya needs no introduction at all because he is the now West Bengal has been put in the map of academic psychiatry in India. And people like you, Ranjan, Sujit, and others have doing a lot of work for this. And Ranjan is someone who is not apart from his academic and research work. He has so many papers in different international and national papers. Along with that, the way he interacts with the people, and he's one of the most popular people around and most handsome also. That is also beside the point, but I add on this. So Dr. Ranjan Bhattacharya will be speaking on this very important topic, which have been for me also very area of interest. In fact, the first editorial I wrote 7 years back on Eastern Journal of Psychiatry was Motion is Emotion, and to look into the gut-brain axis. So two things are very important to understand for the gut, because in psychiatry, a lot of nowadays we are talking about immunology and others. So as skin is external, the gut's lining is also external, though it is internal, but since we take food, so it has a lot of immunological properties in it, and it has one of the broadest network of nerves. So it is no wonder that gut plays an important role in all the affecting and modulating brain and particularly psychiatric disorders. So I will not be going into this. Already Dr. Kaustubh, Dr. Sajjan Singh, and Dr. Sanjay has already elaborated on this. So everybody will be waiting for Ranjan to speak scholarly on this. So I invite Dr. Ranjan Bhattacharya to speak on this topic. Thank you.
Very good evening, everybody. So we are just today's short of a big festival, the Dol Jatra and the Diva and the Holi. I wish everyone happy Holi in advance. And we the psychiatrists are eagerly waiting for the biggest conference, annual conference of our society and SIPS 2022 to be held down the lane within 7 days. So before this is an important webinar that has been organized by the IPS West Bengal State Branch. Thank you so much to the office bearers of the IPS West Bengal State Branch for considering me as a speaker for this important CME. Respected Professor Dr. Om Prakash Singh sir, Honorary Editor, Indian Journal of Psychiatry. Respected Dr. Sajjan Singh, President of IPS West Bengal State Branch. Dr. Kaustubh Chakraborty, my friend, Honorary Secretary of IPS West Bengal State Branch. Dr. Sanjay Garg, Honorary Treasurer of IPS West Bengal, as well as Honorary Secretary of IIPP West Bengal State Branch, and all my seniors and esteemed colleagues and juniors who have joined this session. I'd like to request Nehal to share my slides from our end, and so that I can start here. So as already has been mentioned, Yeah, please kindly share the slides.
Yes, sir.
Make it full screen.
Yes.
So as mentioned, that next one, please. So as mentioned that the IBS, irritable bowel syndrome, and about the gut-brain axis by my predecessors and exhaustively described by Dr. Sajjan Singh and Dr. Sanjay Garg. So all of our psychiatric illnesses are mostly popularized in various Bollywood as well as Hollywood and Tollywood movies. And one of the such movies is the Piku, where the lead actor, Mr. Amitabh Bachchan, he was suffering from the irritable bowel syndrome, and he had a famous dialogue to make to his daughter on screen, Deepika Padukone, that semi-solid stool in liquid motion, kya karu? So as Motion in Emotion rightly said by our honor editor, who wrote in his editorial in Eastern Journal of Psychiatry 7 years back. So it has become a very reality that we are having more cases of the irritable bowel syndrome, and the gut-brain axis play a very crucial role. Next, please. Can you move the slide, please?
Is it not moving, sir?
Not moving.
Give me a second.
So,
Is it moving now, sir?
no.
Just give me a minute, sir. Yes. Can you see my screen, sir, now?
Yeah. You move one more slide.
Yes, sir.
Yeah, perfect. So at the outset, I would like to make this statement that I do not have any conflicts of interest or competing interest. I didn't pay any remuneration by anybody. And as you can see that I am making a perfect balance. So neither on this side, neither on that side. And that is the perfect balance that we need when we will consider the treating our patients having anxiety and depressive disorders. The role of prebiotics and probiotics doesn't end with the management of the anxiety and depressive disorder. I will come to the different aspects of their utilization during my presentation. Next, please. But this balance is very delicate, as you can see. Next, please.
Yes, sir.
But the balance between disease and health, it is extremely important, as microbiome and microbiota, these concepts are evolving up. And as mentioned, that microbiome is a collection of the microbial genome, and microbiota is a collection of microbes. The stress can be caused by the numerous factors like the chronic illness, chronic diseases, various socioeconomic factors like divorce, migration from one place to another. So these will invariably lead to the derangement of the normal healthy process, and that will invariably lead to the disease process. As many bacteria as host cell in human body are innumerous, and 150 times more bacterial genes are there than our human genome. We have now completed sequencing of the human genome as per the Human Genome Project, but it is unimaginable that how there are more than 150 times of the bacterial genes are there compared to the human genome. Next, please. So this is all about the GI tract, and as you move from top down, you can see the various concentration of the bacteria in the stomach and duodenum to coming down to the colon. They are increasing. In the stomach and duodenum, it is around 10 to 100 colony forming unit per milliliter, and most of these bacteria are Helicobacter pylori and Streptococcus. Down the stream, the jejunum and ileum, this concentration is increasing to 10 to the power 4 to 10 to the power 8 per CFU ml, and most of them are bacteria, Streptococcus, Lactobacillus, Bifidobacteria, and Fusobacteria species. And in the colon, the loaded colon, sigmoid colon, and the rectum, that concentration is around 10 to the power of 10 to the power 12 CFU per ml. And most of these bacteria belongs to the group of bacteroids, Faecilibacterium, Ruminococcus, Rosevaria, Bifidobacteria, so on and so forth. So these are extremely important. Some of these bacteria are beneficial for us, and some of the bacteria are detrimental. So while treating with the antibiotics, we most of the times we are damaging this beneficial bacterial flora, and that is going to harm our GI system, and that leads to the various symptoms. As mentioned, that IBS is one of them. Next, please. So microbiota has different functions to play. These are protective function, structural function, metabolic function. These three group of functions they predominantly play, and extremely important nowadays. These probiotics are recognized for their role in the bidirectional communication between the gut-brain, as mentioned as gut-brain axis. The microbiota gut-brain axis consists of the various systems like internal nervous system, ENS, neuroendocrine system, neuroimmune system, and the gut microbiota. And there are good bacteria, as I mentioned, and these good bacteria are used for the probiotic therapy to improve our health condition. Next. So we can see the lumen here in the middle and the columnar epithelium, and we can see the gut mucosa, the outer mucin layer and inner mucin layer. We can recall from our days of physiology. And the digestion process goes like this. From the left to right, it is passing downwards, and we can see the undigested food particles are staying here. Next, please. Now, gut microbiota brain communication has very important role to play. On the left-hand side, we can see the stress response coming through this HPA axis, hypothalamus, then pituitary, CRF is stimulating pituitary from the anterior pituitary, ACTH is being secreted, stimulating adrenal, but going to the circulation, releasing cortisol. And this is very, very important because cortisol is the stress hormone, and the release of the stress hormone can lead to the various effects. And we know the glucocorticoid class of hormone are very important for this, responsible for the stress. And it is when health effects are numerous, like in general, cortisol stimulate the gluconeogenesis, the synthesis of the new glucose from the non-carbohydrate sources in the liver, also in the kidney and the small intestine. Cortisol also plays an important but indirect role in the liver and muscle in the glycogenolysis. Paradoxically, cortisol promotes not only gluconeogenesis in the liver but also glycogenesis, and cortisol is thus better thought as a stimulating glucose glycogen turnover in the liver. And also during this process, it is we know that the third messenger system in our brain, which is getting activated and which is leading to the inhibition of the BDNF and the apoptosis process are speeding off, and this is causing detrimental and permanent programmed cell death. So the stress is detrimental. Little bit of stress initially will be beneficial, but at some point of stress, when eustress becomes distress, it causes lots of damage in our body. On the right hand side, we can see the various mood, cognition, and emotion, and tryptophan is an important essential amino acid which is being converted to the serotonin, the most important monoamine that regulates our mood symptoms. And the gut microbiome plays a very interactive and important role for controlling the responses of cortisol and tryptophan, as you can see in this diagram. Next, please. So it's a bidirectional communication. There are central nervous system, partly the brain and spinal cord, autonomic nervous system pertaining to the sympathetic and parasympathetic nervous system, enteric nervous system, which is extremely important while dealing with the gut-brain axis. These are the intrinsic nervous system of the GI tract, hypothalamic, pituitary, adrenal axis and stress response, and microbiome. There are collection of microorganisms and their genomes in the gut. So basically, these 5 systems plays a very crucial role when we come to the brain biotics and the gut microbiota brain communication. Next. And we know the vagus nerve, the parasympathetic division of the autonomic nervous system, are a very important, plays important role. Vagus control all the peristaltic movement, as well as they concerned about the lower esophageal, takes a control of the lower esophageal sphincter, and that leads to the gastroesophageal reflux syndrome. And also the animal and pre-animal clinical studies have proven that the probiotic effects on brain are dependent on the vagal afferent signals. certain probiotics and the like Lactobacillus rhamnosus directly activates the vagus neurons and induces region-dependent alteration in GABA receptor expression. Initially, before preparing this presentation, actually, I am not a very good advocate of this probiotic concept. But as I learned from the course, as I studied some of the articles and their role, I have found that it's extremely important, and there are scientific basis of using this probiotic group as a therapy of many psychiatric illnesses, not restricted to the anxiety or depression. Next, please. So, what are the brain biotics or psychobiotics? The brain biotics can be defined that confer the mental health benefits of the host when ingested in a particular quantity, not less, not more, the particular quantity. And as you can see that this proglumin has a very specific quantity of different bacteria that are being used and approved for the use as a revolutionary brain biotic. It has been found that this bacteria provides the benefit through the HPA as well as immune response to inflammation and through production of neurohormones and the neurotransmitters. Next, please. And you can see that there are lots of benefits of these probiotics. It is not restricted for the maintaining of the good digestion only. It has antioxidant effect. It improves the neurotransmitter balance, improves the mental health, fight the ravages of aging, metabolize the xenobiotics, reduces inflammation, so on and so forth. So the probiotics roles have been day by day are increasing and their importance are being understood. Recently, probiotics are recognized for their role and for the GABAergic transmission. As we know, the GABA, serotonin, and other neurotransmitters are extremely important, and they are being targeted with therapeutic process of the psychobiotics. Psychobiotics are the live organism that, when ingested adequately, they give the benefits. And psychobiotics are reported to reduce the cortisol level as well as the various neurological and psychiatric parameters such as improvement of the sleep, mood, cognition, appetite, so on and so forth. Next, please. So, influence of the brain of the gut, you can see the motility, secretion, and the nutritional delivery. And next, please. On the other way, the neurotransmission, stress and anxiety, and the mood symptoms. So this gut-brain axis is a two-way axis, and we can see that the gut can control the brain and brain control the gut. And it is important that whenever the person will be having the anxiety or depressive symptoms, their GI motility will get affected and the vice versa. Next, please. Now, connection both in both ways, as a troubled intestine can send signals to brain, and the troubled brain can send signals to the gut. And stomach or intestinal distress can be cause of the product of the anxiety, stress, and depression. As we are known of the fact that anxiety and depression can be seen in 30 to 50% patient with chronic gastrointestinal symptoms and are thought to be associated with the gut-brain axis. It is a signaling pathway between the CNS and ENS, and as we can see with the evidence that the gut-brain axis and the gut microbiome interact in both healthy people and the patient with the inflammatory bowel disease, irritable bowel syndrome, obesity, cardiovascular diseases, and depression. The gut microbiome is postulated to interact with the gut-brain axis via three pathways: stimulating the intestinal epithelium to secrete the neuroactive molecules, affecting serum cytokine levels as mentioned already, and directly activating the vagus nerve, therefore modifying the gut microbiome, which is in turn modifies the activity of the gut-brain axis, is expected to improve the symptoms of anxiety and depression. Next, please. So cortisol as measured as stress hormone, and cortisol plays a very crucial role for controlling sleep-wake cycle and boosting the mental energy, which helps to handle stress and anxiety. But just remember about the cell signaling pathway. We know that in the outer cell membrane is there, in inner outer cell wall and inner cell membrane, there are 7 transmembrane G protein coupled receptor. Outside the cell wall, there is a receptor where the drugs, virus, bacteria, or any pathogen can bind, which leads to the activation of the phosphoinositol diphosphate in the inner cell membrane layer. This phosphoinositol diphosphate will convert the inositol triphosphate IP3 to diacylglycerol, and the ATP will be break down to generate the cyclic AMP. Now the cyclic AMP downstream will regulate the CREB protein, the cyclic AMP receptor element binding protein, which will be directly downstream interact with the brain-derived neurotrophic factor, and that will lead to the that will activate the mRNA to transcript. And this cell signaling pathway is so important that for the last 25 years, 4 Nobel Prizes have been awarded in this pathway. And stress can be detrimental by damaging this pathway. So it's extremely important for having a controlled sleep-wake cycle, and probiotics can play a very important role for managing this. Next, please. And GABA, as we all know, the GABA benzodiazepine chloride channel receptors are there. GABA is an important inhibitory neurotransmitter that blocks the impulse between the nerve cell and brain. The low level of the GABA has been attributed to the host of psychiatric conditions like anxiety, mood disorder, epilepsy, depression, insomnia, mood disorder, so on and so forth. The GABA agonist drugs as well as these probiotics have GABA stimulatory property, which helps to relieve this anxiety. So that's why they are directly and indirectly by acting through the GABA can reduce the symptoms of anxiety and improve the symptoms of the functional bowel disease or irritable bowel syndrome. Next, please. And GABA cortisol plays an important role in cortisol anxiety. They go by hand in hand, and their increasing cortisol level has a reciprocal effect on the GABA level, and that leads to the anxiety. So more cortisol and less GABA will lead to more anxiety and depression. So we need to reduce the level of cortisol, and we need to stimulate or activate the GABA neurotransmitter. Next, please. This HPA axis already mentioned that is a primary neuroendocrine response. In our days, we have done the dexamethasone suppression test to assess the HPA axis. Now, under chronic stress, the cortisol is overproduced through the stimulation of this axis. Probiotic, how do they affect? They affect the HPA axis by significantly downregulate this, which responds to the stress, and thus the HPA axis gets disconnected and less stimulation occur, and that leads to the less damage to the neuron or the apoptosis. So extremely important for the activation of the by the probiotic supplementation by GABAergic pathway, downregulating the HPA axis in response to stress. Next, please. And we know the GABA pathway, how it comes from glutamine, the amino acid to glutamic acid and GABA. Glutamine is converted in presence of the enzyme, the glutaminase, which is finally converted to the GABA. Next, please. And there are other neurotransmitters, their role comes with hand in hand, and we know that the acetylcholine, noradrenaline, adrenaline, GABA, and serotonin are the prime neurotransmitter which regulates this gut-brain axis. And you can see in this diagram, but I think it is not to discuss broadly due to the paucity of the time, but you can see how this tryptophan metabolism leading to the generation of the serotonin, and how enterochromaffin cells are regulating locally as an enteric nervous system, and the vagus nerve acting through centrally by inhibitory tonic control and regulating the overactivation of the GI tract. Please, next one. It's a simplified way. We can go for the left and right column. The GABA relaxes LES, lower esophageal sphincter. Norepinephrine decreases motility and increases contraction of the sphincters, inhibits secretion also. Acetylcholine increases motility and relaxes sphincter, and serotonin facilitates serotonin and peristalsis. Next, please. And very important, what are the prime bacteria that are concerned with the activation of this neurotransmitter? The lactobacillus and bifidobacterium are principally being attributed for stimulating GABA. Escherichia, bacillus, and Saccharomyces responsible for the norepinephrine. Acetylcholine primarily controlled by the lactobacillus bacteria, and the Candida, Streptococcus, Escherichia, and Enterococcus. These bacteria primarily acts through serotonergic system. Next, please. As we know, the biogenic amine that function as a neurotransmitter, we all know then how the tryptophan is being converted to 5-hydroxytryptamine. GI secretion, GI motility is thus being regulated. But 95% of the serotonin is contained in the gut, in the mucosa, and the nerve terminals of the ENS. That is very important. Alteration in this transmission may underlie the various pathological process, and SSRIs are known to modulate various psychiatric and GI disorder like IBS. So that's why when the no other drugs like proton pump inhibitors act properly in the managing of the irritable bowel syndrome, our SSRIs do the magic. So that's the key for the action of the SSRIs through this pathway. Next, please. And we know that gut hormone and neuropeptides role are also extremely important, and it is going through the in the gut mucosa. There are various cells like M cells, the enterochromaffin cells, L cells, so on and so forth. And there are microbial factors, gut hormones, and cytokines and sensory neurons primarily regulate these, which leads to the appetite and energy homeostasis, and also the emotionality and mood symptoms. The neuropeptide was also being controlled by the various factors like food intake, energy homeostasis, anxiety, mood, and cognition. And they act by the various cells like pancreatic F cells as well as the mucosal L cells. And they regulate gut motility, gut secretion, local blood flow, and the mucosal immune system. Next, please. And this is in a nutshell how this getting activated. We can see here that gut microbiota, gut mucosa, and gut immune system plays an extremely important role by microbial factors releasing cytokines and sensory neurons. And downstream, it has been regulated by the autonomic nervous system and the neuroendocrine factors. So these two process goes hand by hand, and appetite, energy homeostasis, the mood symptoms are thus being regulated. This GBA, as mentioned, the bidirectional system, CNS and ENS, how they act, it has been beautifully described or portrayed in this particular diagram. Next, please. And the neuropeptide Y symptoms, as mentioned in the previous slides, how they act can be seen here. And the important part of this, the neuropeptide Y acts through brainstem, spinal cord, and sensory neuron and regulate the sensation of the pain. Please, next, please. Now, gut hormone and neuropeptides, how the germ-free studies suggest that the gut microbiota mediates and regulate the release of the gut peptide. You can see the various neuropeptides like ghrelin, gastrin, orexin pathway. There are each and one is unique pathway, and everyone it is not the scope of this discussion. We have our group of life same psychiatry. In one of these classes, we have discussed elaborately about the role of the gut hormones and neuropeptides. The feeding behavior, energy homeostasis, circadian rhythm, arousal, and anxiety, they also control the hormonal signaling pathway, and gut peptides from enterochromaffin cell, EC cells, can act directly to the brain. Next, please. And you can see here that how the microbiota derived signaling pathway acts in this way, that under anaerobic condition on the large intestine, as I mentioned in the colony forming unit count is increasing from the transverse colon going to the descending colon and sigmoid colon, rectum. So as the microbiota concentration is increased and undigested carbohydrates are fermented, there are various short chain fatty acids come into the play, like acetate, propionate, butyrate, and various gases that are generated. And we know that hydrogen carbon dioxide and the hydrogen sulfide are generated, and they lead to the multiple effects on the host, like energy sources for the host, butyrate being the consumed mainly by the colonic epithelium, and availability systematically, like circulating this short chain fatty acid can be carried by across the blood-brain barrier. Next, please. So this is in the nutshell how the diagrammatical, like we can put the appetite control, gut motility, energy expenditure, and how it affects in our various anti-cancer effects. So inflammatory process, peptide hormones, and the endocrine hormones play various crucial roles, and they have interactive role to play. Next, please. So in this way, we can conclude that indicating neurological and physiological factors enable bidirectional communication with afferent and efferent signals via vagus nerve and neuropeptide. Microbiota can influence behavior, neurophysiology, and neurochemistry. Short chain fatty acids represent the set of metabolites and having widespread health benefit, as mentioned already. Microbial-based therapeutics remain the topic for further indication. This is the first part of my presentation. I will come to the second part about the clinical features, clinical implications. Next, please. And there are 2-3 terms we use synergistically, as pro, pre, and symbiotic. The prebiotic is a substrate, and that is selectively utilized by the host microorganism. Probiotic are the live microorganism that has been approved for the therapeutic purpose, and that has been brought by the Septalis with the brand name Proglumine. And the symbiotic is the product that contains both probiotics and the prebiotics. Next. So these are important, the three parts, that PDX, SCF, and NFC. These are the NFC, you can call it, that's how the placebo control trial has gone. NFC is the no fiber control. SCF stands for the soluble maize fiber, and the PDX stands for the polydextrose. Next, please. And these hand-to-hand are found that this polydextrose has been found to preserve the gut bacteria and has a shift into the beneficial side, and the probiotic is enhancing the favorable gut bacteria, and that lead to the increased production of the various microbia shown on the right hand side. Next, please. And this plot, you can the scatter diagram, we can see here the principal component analysis has been done, PC1, PC2, and PC3. As I have mentioned that initially I was very apprehensive to give a talk about the probiotics, but when I found this statistical data and that is favoring the claim of role of probiotic in the various psychiatric condition, then I could understood and I got understood and I checked the various sources, and I have found that this is incredible, and this could be the future strategy for therapy of many psychiatric illnesses. Next, please. So another design is the agave inulin. So agave inulin is a very important concept, and they say that the good gut health is a sign of the healthy living. In other words, whatever happens in our gut will reflect on our overall well-being. Like prebiotic is a counterpart to it, and one of the most common types is the inulin. Today, an increasing number of people are incorporating with the inulin as a part of their daily diet to discover the various health benefits. And the inulin is from the agave plants, and this assures the good health. And that comes where the agave inulin is a soluble fiber, is extracted, and these are available commercially. I have checked in the various online platforms, the inulins can be purchased online, and which occurring sugars found in the plants, and a great source of the nutritional benefits. And agave is a native plant. Actually, it is found in the Mexico and in the southern western United States. And it's been quite a few years that the plant is considered to be a great source of the nutrition and the taste. Next, please. And this therapeutic trial has been found that agave inulin increase the bifidobacterium and decrease the detrimental bacteria that is destroying other gut microbiota, decrease Desulfovibrio. Next, please. And these are the food sources of the various dietary fibers: fruits, green leafy vegetables, whole grains, nuts, and legumes. We all recommend to our patient, and most of the favorable question as that we are having the gas, as sir mentioned by Dr. Sanjay, that most of our patient will come with that the gas has gone to my head. And most of the patient before leaving your clinic will ask, Dr. Saab, what are the diet you will recommend to us? I repeatedly tell them that you need to visit a dietitian. That is an individualistic diet that has to be formulated for everyone. No uniform diet should be there, but they keep insisting me, and I give them their response with these 5 things: that fruit, vegetables, whole grains, nuts, and legumes. Next, please. And these are the various prebiotic substrates like oatmeal, barley, onions, greens, berries, bananas, legumes. But when you get in a single capsule, then it is you do not to bother about this to give this answer. You can simply prescribe the probiotic in the form that has been the sponsor's proglumin. Next, please. And these are the various probiotics in foods. The list is exhaustive. I am not going to the detail. Next, please. And the GBA, as you know, the gut-brain axis prebiotics, the galacto-oligosaccharides or GOS, 5.5 gram per day. These are the very important nutraceutical value. And being a nutraceutical like the Food and Drug Administration, there are particular dosing has to be recommended for the introduction in the market. So appropriate dosing has been given to by the manufacturers, and they have brought into the market. Next, please. So 4-week intake of this drug in the fermented milk in healthy women affected with the brain regions has been found that they have increased with this particular concentrations are required. And Bifidobacterium, Streptococcus, Lactobacillus bulgaricus, and the Lactococcus lactis subspecies are given in a various therapeutic doses, and beneficial effects on general signs like relieving anxiety, depression, and reducing the cortisol level, as mentioned in the neurobiological segment. I have explained the neurobiology of mechanism of action of these probiotics. Next, please. A neurological and physiological connection enable the bidirectional communication. And identifying the utilizing keywords, nutrients, microbes to modules, microbiota for health benefits are very important in this regard. Next. And these are the some clinical trial. Just we will go through the salient finding of this trial, the effect of multi-strain probiotic formulation in a double-blind placebo-controlled study. A total of 80 students of 18 to 24 years have been given, and those who consume probiotic capsule showed a significant reduction in terms of the PSA scale, DAS scale, and STI scale. So we can see the perceived stress scale, depression, anxiety stress scale, and state trait anxiety inventory. These scores have been found significantly reduced after consuming probiotic. So scientific evidence is clear cut. Next, please. We can see these are the initial inclusion part, how they have included and how they randomize, how allocated, and how there are lost to follow-up group and the protocol deviation. And after this, the analysis has been done for the intervention versus placebo vis-a-vis comparison. Next, please. And we can see the difference and all the differences going to the extreme right-hand side of the p-value. We can see all the scales, PSA, DAS, STI, and serum cortisol. Use of probiotic supplement has been found that this has been effective in reducing all these scales related to depression, anxiety, and stress. Next, please. And we can see here the group of comparison and the effective plot on the left-hand side, how the effect of probiotic and placebo on these scales. Next, please. And we can plot it here in the change of the Hamilton Depression Rating Scale and the quality of the life scale. We can also find the significant improvement here. Next, please. And this is another huge sample that almost 2,000 records identified through the database. And after screening, this has been found that this Prisma flow chart has found that the regression analysis and various methods has been calculated, and you can see in the left-hand side group, the p-value, there is significance in the various aspects of the health benefits. Next, please. And the chronic GI disorder having anxiety and depressive symptoms, and these are all published in the leading journals, and you can see this has also found that the effect of the probiotic on the GI disorder having anxiety, depression symptoms relieve the both depression, anxiety symptoms as well as the quality of the life scale. And these disorders have been diagnosed with the Rome 2 and Rome 4 stages, and they have found that the effective probiotics are effective in managing the irritable bowel syndrome as well as controlling underlying depression and anxiety symptoms. Next. This is a very cumbersome, this is a meta-analysis, and I just like to highlight here that all the studies have been done for the duration of the 4 to 8 weeks, but some of the trials have been done in a longer period for 12 weeks and maybe larger, and some probably that a trial for a year will be required to find the effects. But this short-term intervention have been found by the various researchers that the probiotics are extremely beneficial for the managing not only the anxiety and depressive symptoms, but other disorders of the stress are getting benefited with the use of these probiotics. Next, please. And these are the various natural condition, and we know that the viral exposure and how the lockdown has impacted. Now this leads to the lots of stress, and there are studies with how dysbiosis can be shifted to the symbiosis by the use of these probiotics. Next, please. And in this study of students, and we can find that when the probiotic or placebo capsule given twice a day for the 28 weeks, it shows a significant reduction of these scores. Next, please. And so, in a nutshell, this is the HP axis and stress effects of stress, and then how brain biotics are effective in controlling and improving the neurospecific gut flora, and thus getting beneficial for the lots of conditions related to the anxiety and the depression and reduction of the stress. Next, please. Next. And this, how by the virtue of the GABAergic pathway stimulating the GABAergic inhibitory neurotransmitter, these probiotics are helpful for reducing the anxiety symptoms. So by vis-a-vis in a two role by the HPA axis and as well as the GABAergic pathway, the probiotics are extremely beneficial for controlling mood and anxiety symptoms. Next, please. So this is in the marketed, and the dose is 1 capsule twice a daily, and it is a worth of trial for giving to our patients, and that could be one of the revolutionary brain biotic that can be a game changer for managing the host of condition, especially having the GI motility disorder associated with anxiety and depression. Next. So this is the composition, as you can see from the manufacturer's end. These are the basically these 7 bacteria at a particular concentration has been recommended for the use. Is a unique combination of the neurospecific 7 probiotic strains which work by reducing cortisol and increasing GABA. So I would recommend that it's a trial that we can just give to our patient, and there are other options. But I think that one of the restraints could be the cost of therapy, and I think the manufacturers will soon reduce the cost, but it is not too much so that we can recommend it. But the problem with us, the co-prescription of the other drugs can increase the cost of therapy. So otherwise, it's a very, very good drug, good molecule we should advocate to all of our patients, especially having the anxiety and depressive group of disorders. Next, please. So these are the references, and I'd like to give a trial of the probiotic food. Instead of choosing these 18 dishes on the left-hand side, we can simply give the capsule proglobin, which contains the 7 bacteria strain in appropriate and effective dosage. Thank you for your patience hearing. I'd love to answer if any queries being generated.
Thank you, Ranjan, for really covering the basic sciences and also the use of probiotics. And I think that this must have stimulated a lot of brains, and there will be a lot of questions also, because that was people are praising it. But I want that there must be some questions also, so that we can take the discussion further. Any questions in the chat box?
I'm just checking that, sir.
None yet.
Anybody
PGTs
has
are
any
happening?
questions, please ask.
Yeah. Particularly the PGTs. If any PGTs are happening, they should ask questions.
Because this is a wonderful topic and wonderfully done. But still, I think that there are a lot of understanding possible, so we can utilize Ranjan for that.
Only words of appreciation are received. No other queries.
So it is complete. You have covered everything, and a lot of appreciations for that. And of course, it is we should need a trial, and we should be trial not in the sense that clinical trials, but in the our day-to-day practice trials, and see the effect and utilize this. Because as Dr. Garg also mentioned initially, you used to laugh that the gas mathay uthe jay, but we now understand that ki gas mathay uthe jete pare. Sejono gas, we have to try to reduce that and manage by other means. So thank you again, Ranjan, for excellent
only one
presentation.
part I'd like to mention here, sir, with your permission, sir. That is this trial has been done for all the trials being done with the comparator arm of the placebo. So for the generation of the FDA approval, we need a double-blind randomized placebo-controlled trial. But for the real efficacy scenario, we need a head-to-head trial with the prime drugs. So we need the trial with the prime comparator drug like SSRI or other group of drugs. That is required, and down the line, especially we know that some of the drugs like NASA group of drug, mirtazapine, it is also having the beneficial role for the GI symptoms. So certain vis-a-vis trial of the drugs are down the way. So it has got the approval, and we are using it. And we need more young researchers in our IPS forum who can do those researches, how this vis-a-vis drug trial can be done.
Dr. Singh, I have a question. Opida, can I ask you?
Go ahead.
Ranjan, an excellent presentation as usual. That's what we expect from you, nothing less. So 2 things which I wanted to ask you. One, like usually we know that when we use an SSRI, we expect that at least it will take 2 to 3 weeks before it starts functioning. So similarly, in this case, like, is there any time period before it starts functioning, before it starts showing any effect? Because in most of our patients, they want the result tomorrow. You start the medications, they want the result tomorrow. So what should we tell them when to sort of have an expected effect when we are using probiotics? That's my first question. And secondly, how long should we continue them?
Yeah. First to answer very interesting and very clinically relevant question, Dada, and thanks for your word of appreciation. So coming to the first question, one study has been done here. I have shown the slide by Dr. Venkatraman et al. And his Venkatraman et al. Has shown that the probiotics are effective within 7 days. So first 7 days of treatment, we have seen the efficacy. But the problem is that we had these similar claims with other drugs like vilazodone. We have seen that vilazodone will be an effective antidepressant theoretically. If it is given within 7 days, we'll get the desirable report. But we are not getting the desired response within 7 days in a true sense. But we need to see. But the claim is that within 7 days, by Venkatraman et al., they have published this study, and that is effective within the within 7 days span. The second question about the how long. So for this question, we need certain parameters to be addressed, like safety, tolerability, efficacy. Now we have this trial for the approval. We know that FDA requires an approval for 6 to 8 weeks trial, at least 2 or 3 trials to be positive. So for that, it is getting approval. And as in this meta-analysis, I have shown that the most of the trials are being done for the 6 to 8 weeks. One trial has been done for up to 12 weeks. But we need a longer trial for at least 52 weeks to know how it is effective and how its effect remains sustained. So that's a lacunae, as I mentioned, but still there 12 weeks trial has shown the beneficial effect.
Thanks a lot, Ranjan.
Okay, any question?
Yes, thank you, sir, for this wonderful presentation. And I think we all have enjoyed this presentation, and this was a very, knowledgeable, and we can have a lot of takeaways with us. I have received one query on WhatsApp that, according to you, can this strength of probiotics cause constipation or diarrhea?
Yeah, that is basically irritable bowel syndrome is nothing other than it is an extension of anxiety group of disorder. So we know that IBS has 4 variants. One is IBS diarrheal predominant, IBS D, IBS C, that is irritable bowel syndrome constipation predominant, IBS mixed M pattern, when the both patterns are almost 50-50 and the patient is not aware that which one is predominant, and IBS U, that is irritable bowel syndrome undifferentiated. So usually the person having irritable bowel syndrome will have the episodes of alternating diarrhea and alternating constipation. So during this phase of alternating constipation, sometimes the constipation factor may aggravate. But the problem is that, as I mentioned, this brain-gut axis is a bidirectional talk between the brain and the enteric nervous system. So in those cases, I think, apart from the pharmacotherapy, the relaxation exercises, deep breathing exercises, JPMR, and these sort of stress busters can have a lot of help, because this goes as a vicious cycle. I am having constipation, then I will again have to trouble in defecation, have to stay longer period in our washroom. So this will go as a vicious cycle. For removing this concept, we need for comprehensive cognitive behavioral therapy. For catastrophization and other cognitive errors, we need to assure those patients, and most of the cases, health education and psychoeducation plays an important role, how this brain-gut talk occurs and how you can yourself control your symptoms of constipation and diarrhea.
Thank you, sir. Thank you so much. So I just check if there are any questions.
Bifilac, and a question has been of a commercial product, Bifilac, how it is effective, somebody has asked. I would like to mention mostly it is the lactobacillus or Saccharomyces cerevisiae like group of things. It has not having this 7 bacteria effective studied component. Effective dosage has not been marketed elsewhere. So those are the, I can call them first generation drugs, first generation probiotics, and we are having this 3rd or 4th generation probiotics. So brain biotic revolutionary role, I'll recommend and go with the keep changing part. So all the other change yielding place to the new, and Lord Tennyson said. So I'll always recommend to go for the more evidence-based product like Proglumine.
Thank you, Ranjan, again for clarifying. Kaustubh,
Yes.
over to you.
Okay. Okay, so nothing much to add. Excellent presentation by Ranjanda. Again, I want to thank Septarit Life Sciences for bringing up this topic. I think all those have heard this presentation are immensely benefited and become enriched and will be encouraged to use this kind of product, both prophylactically and for the treatment of anxiety and depression. Thank you all. Have a good night and I'll see you in the next meeting. Thank you all.
Thank you.
Happy,
Thank you,
happy
sir.
advance Holi and Dol Jatra to all of you.
Yeah.
Yeah. Happy
Definitely.
Holi to everyone. Nice
you.
to see you.
Happy
Holi to everyone.
Thank you, sir. Thank you.
Thank you. Good. Bye,
Thank
Ranjan.
you.
Well done.
Bye-bye. Thank you.
Bye, Costa. Good night.
Good night. Good night. Long live IPS.
Long live IPS West Bengal State Branch.
Thank you.